Okay, my name is Rod Peterson. In June of 2008, I was diagnosed with a tumor in my right kidney, and it was renal cell carcinoma. The doctor told me that I had the tumor was 6.7 centimeters. So in August of 2008, uh, I underwent an operation, and they removed my right kidney. During March of 2009, they had found, with the monitoring, that the renal cell carcinoma had actually moved into both of my lungs.
After you did your operation, did you do any cycles of radiotherapy or chemotherapy or any of that?
No, no,
None.
I did not. I was told it wasn't required.
Okay.
Uh, and at that point, I went to see my oncologist, and as he was explaining to me what I had, I didn't really understand what I had. I knew I had a cancer. What I thought is it was removed, and I was going to be okay. He told me that the renal cell carcinoma had moved into both of my lungs, and when I was asking him, okay, what's the solution? He said he indicated to me that normally they either they can operate, take it out, or they can use chemo, or they could use radiation therapy, and really none of the above would work with the type of cancer that I had. Uh,
Was this basically a nice way to tell you that you were going to die?
yes, it was. He told me that the operation doesn't work because it would spread further, or it would just come back somewhere else. Chemo or radiation therapy would not work or would not be effective in this type of cancer. So basically, he told me to go home and enjoy the rest of my life. He gave me a card for the psychologist if I needed them, and I left the office. So
Welcome to the medicine of the third millennium, I guess, huh?
yeah,
I
yes,
mean, this is
it was
like
fairly. I was fairly numb, so to speak.
um, after this great news, what did you do?
Well, I again, I really didn't have a lot of options. I didn't think. So I started talking to the friends, and I had heard about Dr. Tullio Simoncini. Started doing research with on Dr. Tullio Simoncini. I realized after the research that I believed his research was correct. That cancer is a fungus, and it just started making sense. So I started following the
Oh, let
fungus.
me stop you for a second.
Uh,
As you're not a doctor, based on what are you saying that this made sense to you?
well, as I'm watching the videos and realizing, I started researching fungus. I started researching, and there's other information out there from other doctors that are accredited doctors who are saying some of the same things that
Right,
Tullio is saying.
right.
Right? So we decided to fly to Rome just to talk to Dr. Simoncini in person, and we actually flew to Rome in July of 2009. Tullio, when I met Dr. Simoncini, he's you could tell he was a matter of fact, and we flew to Switzerland and met the associate, and I started the treatment, and it was back. I finally went to the treatment in August of 2009, and I was there for 6 weeks, and I
Yeah,
went through the
sorry,
treatment.
you're talking about the Simoncini treatment.
Yes, uh,
So this is basically under Simoncini's supervision.
yes, absolutely, it was. And so after the treatment, I was curious. When I came back, I had my CT scans, and you could clearly see from the past scans where the tumors were kept constantly growing. All of a sudden, they had shrunk in some cases in half, and substantially in other cases.
And this is after the first cycle,
Af-
let's say.
yeah, after the treatment that I had in August. Of course, it was very exciting. My oncologist was just ecstatic.
This is
Ecstatic.
This is the same one who had told you to go home and relax?
Yes, yeah. And then he started to say, well, 1% of the population, this only happens with him. If it continues, we're going to have to do a write-up on you.
Wait a minute. Now, did you tell him that you were doing the bicarbonate?
No, I did not. So, but I wanted to make sure I could feel the difference after Dr. Simoncini's treatment. So, in January and February of the following year, 2010, I went back.
To Switzerland, you mean?
Yes, I took the first 2 weeks of treatment, and I went and I had a CT scan to follow up with because I was tracking it the whole time. And my tumors again had shrunk in half.
Just after 2 weeks of a second cycle?
Yes. So I continued with another 2 weeks of treatment and came back to Canada. And the tumors, the last CT scan, which the first one when I returned, the tumors they were gone. All there was scar tissue.
So basically, after 2 cycles, one in August 2009 and one in January 2010,
Yes.
you got rid of your tumors
Yes.
completely.
Yes.
Well,
So,
what did you think of then?
well, because of Dr. Simoncini, I have a second chance in life. And I believe everybody should have that. Now, just to follow up to make sure, I just came back from another CT scan, which is again, it's now been it was 3 months. I'm still clear.
This is the one you took in May 2010,
Yes.
and that confirmed that you're still clear.
Yes, it did.
In fact, I remember when I was interviewing this Swiss doctor a few months ago, he told me that there was a patient in Canada that was under treatment. It was doing very well. They didn't know the final outcome yet, but he said it was looking very good.
Yeah, that was me.
That was you. So it seems to be a very small world in a way, huh?
It does, yes.
Now, just to make absolutely sure, did you do any treatment at all, whether orthodox or not, between the first and the last cycle or during the first and the last cycle, besides the bicarbonate? In other words, can you be absolutely positive that the bicarbonate is what cured you and nothing else?
Yes, I can. There was no treatment. Like I said, there was no treatment offered to me. What I was told was to go home, relax, and enjoy the rest of your life.
Okay.
And fortunately, I have 6 children, 7 grandchildren, and I wasn't really ready to do that. And by meeting Dr. Simoncini, well, I'm still here today, and I'm very thankful. I thank God for that.
Also, we have had very good results with a patient from Canada who had a kidney tumor with metastasis in the lungs. And the first result after one cure of 4 weeks were quite good. We have had 50% less of metastasis in the lungs. So it's a very good result. And he should come back to pursue the treatment.